Hello and welcome to the Community Voice. I'm Fara Sax. First, I'd like to thank my stylist, Julian Chang and Gina Z, who has very much dressed me today. But I'm really excited because in the house today is a family of doctors. Dr. Jarrett's Wellness Center are my guests. This unique facility combines traditional medical health care and spa treatment services for a more holistic wellness approach to health and well-being. And I'm so happy you're here today. And you're located in West Kendall, and we have a lot to unravel. And I'm so glad that our audience gets to meet each and every one of you here today, because each of you bring a wealth of information, a wealth of knowledge, and most importantly, what I've gotten to know you through the marketing that we're doing together is the heart. The heart is everything. And all three of you have an incredible heart, wanting to help your community and your support staff in the office. I can't speak enough, and I've talked probably about 20 minutes already. Now it's your turn. So thank you all for coming.
Thank you.
Thank you.
Pleasure to be here.
I want to start because the background of each of you is completely different, and how we got to this moment in time where your wellness center, Dr. Jarrett's Wellness Center for our community, has got here. So together, I think probably cumulatively, you have 60 years experience?
At least, yeah, cumulatively, sure.
But you're each only 30 years old. Dr. Tor, you're like 25, and Dr. Jarrett and Mrs. Jarrett, Sandra, are much younger than that. So thank you so much again. So talk to me about your background, Dr. Jarrett, and how you've come along the way and how you see medicine then versus how you see medicine now in what you're doing in your wellness center.
Well, I originally came from Jamaica. I did medical school at the University of the West Indies in Jamaica, and worked in the Bahamas for a few years before I came to do my residency at the University of Miami. And that was an evolution.
Did you miss it? Did you miss it? We'll do it again. Okay, everybody.
My original plan for residency was to go to New York. In fact, I had gotten into a residency program at Downstate, which is across from Kings County in New York. And at the very last part of the interviewing process, we interviewed at the University of Miami. I said, why not? And, they told me, oh, it's in this tough neighborhood. And I just interviewed at Kings County. So I came to Miami, and at the time, Dan Marino was playing at the Orange Bowl, which was walking distance from where my residency was. It was like a no-brainer. I didn't have to buy new clothes. I just arrived and I went to work. And the residency back then was with Lynn Carmichael, who was the father of family medicine. And it was a small residency. We only had about 7 residents per year, I think. And it was just a wonderful exposure to family medicine as a concept. At the time, what we called family medicine was a total inclusive kind of care, meaning you took care of babies, took care of pregnant women, you took care of adolescents, psychiatric care, and you also took care of geriatrics. So family medicine at the time was, you went to the hospital, you went to people's homes if you had to. It was very comprehensive. That has changed out of necessity and survival. But we are in the evolution of what is now our practice. We have a very inclusive kind of program where we now have a program that embraces all aspects of that, except we don't take care of babies like we used to, because for obvious reasons, it's just a lot more complex. And we're not in the hospital like we used to, though we have to manage patients' care coming out of the hospital and sometimes going into the hospital. So we are now more community-based, and there are so many aspects. There are so many needs in our community for all the different things that go into healthcare. It's complex. It's not just giving the right pill or giving the right shot. It's also addressing the mental health issues, the family issues, and it's Hence, my family kind of all wandered into the program because, my son, he went to Brown University initially, and my other son went to Princeton. He did pre-med, and his brother did economics at Princeton, but he's a doctor as well. And we understand that being physicians allows you to touch so many aspects of what we call our community. So that's a long-winded way of just introducing my evolution.
And I just think it's funny because sitting here is your doctor's bag. I remember we used to have house calls. The pediatrician would come to my home when I wasn't feeling good. And it's changed so much now where they're not given that privilege of that personalized care, I think that's really important with what we're talking about. But Sandra, I want to get to you as the office administrator. Your journey has been an incredible one. Tell us about your background. And you can gloat because I'm going to call you out if you don't.
Well, I like to be in the background, really, and just making sure that everything works and flows. And I call myself the liaison person and the advocate. But in terms of a little bit of background, I actually moved to Miami. I went to an all-girls high school, St. Andrew High School in Jamaica. We turn 100 years this year, so it's a big deal for us.
You look really good for 100 years old.
Ha, ha, ha. But I did medical technology. I got my bachelor's in that through FIU. And then I worked as a technologist at Bascom Palmer. I guess you'd say ocular microbiology, where I was doing microbiology, but then I got trained to do viruses, so virology as well as fungus. And working alongside the physicians and the ophthalmologists at Bascom Palmer, that really made me enjoy the academic part of medicine. And then met the lovely young Wentworth, because he was doing his residency and I was working at Bascom Palmer. And then fast forward, children. And then I had done a master's in public health before we got married. And that master's in public health, where you have health administration courses, it's a good combination. You have the primary thing being to give patients access to healthcare. So in the office, I see myself as a patient advocate. No challenge is too big for me. That's where I am now. And my thing is, I've been doing this 30-something years. If you figure it out, right?
But that's wonderful because you come from both sides, and you're the managerial side and as well as the medical side. So you really understand that marriage between the two.
Exactly.
And then walks in,
yes,
Dr. Tor Wentworth. So talk to me about how this family affair of doctors happen, and what's that like to work with your parents? I want to hear a little bit more about your story, where you were educated, but working with your parents in this family practice. Tell me a little bit about it.
Well, I was a student at West Lab Elementary, which is pretty nearby, and commonly I was asked what job I hoped to hold as an adult, and frequently I would respond that I planned on being a physician. In fact, that was my only response, and what drew me to the job was clearly all of the things my father has mentioned, being able to interact with my community and uplift them in a way that I'm really proud of. But clearly my father was the main motivator and the role model in this area. So I watched Daddy when I was growing up, and he tended,
like third grade, he was solid.
Tended to be whistling when he came in. He had this sort of appearance, and after I had gone to Brown University and University of Miami for medical school and started working in the exact same program in Jackson Memorial in the family medicine department with Dr. Basire, who was our department head. Initially in the hospital, one of the jokes the nurses would play was that, "Come on, say Dr. Jarrett." And I had this urge to start looking for Dr. Jarrett, because up until that point, it was a reflexive team effort to go and find him, so now it was me. So moving forth and being able to work with my parents has really been a privilege for me. It was really like an emotional process initially, getting to know patients that to me were new patients, but that had developed this relationship with my dad. So the patients were very transparent with what was affecting them. So it's like I kind of fast forwarded through this process of getting to know the people with small talk, but that gave me the opportunity to get to the heart of the issues that were affecting them. The lurk factor at is the factor of an issue in the patient's life that is lurking beneath the surface that can be elicited and might actually address why they're feeling unwell, what's causing their illness. This may be something that a patient is shy about bringing to your attention. For instance, we were taught that in China, many patients who are depressed the majority were presenting with a complaint of stomach pain, and this pursuit of the pain in their stomach eventually elicited that they really wanted to be before a healthcare practitioner. So that's just one example of a way where being cognizant of the patient, their ability to communicate what they're feeling, a super duper intelligent person can be very irrational if they're distressed. So being patient on our part, these are some things that have helped me to adapt, to use what my dad said, to evolve into the position 4 years now working in private practice
2021
that I am today.
And you said chit chat, but what I've found is, while talking to the doctor or a doctor, the more you talk as a patient, if the doctor is astute enough, they understand. They're looking underneath what you're saying. There's that little chatter. There's something going on. And I want to bring this full circle to the emphasis that you take upon for the holistic wellness approach to the practice, because there is a medical and there is the spa end, and how you marry them both in one location is fascinating to me. And the reasons and how you got there is what I'd like to bring forward now.
Well, I might have mentioned last time we spoke that when we purchased the spot pre-construction because we had to move from where we were paying rent. And when I was building out the space and we started sketching what we would like to present as part of our community effort, apart from having a traditional medical exam room, we thought that we wanted to have something that I personally experienced and enjoyed, which was the spa type experiences. Sandra and I used to go to a Doral when we were younger, and I said that was so
You're
nice.
still young.
Haha.
Younger. And we wanted something that our patients, and the interesting thing is a lot of our patients who now use our spa services would never think of going to Coral Gables to hoity-toity spot. They'll come to our spot that's, in my opinion, very comforting and very much a welcoming environment for massage or facials, or use a sauna, or to get laser hair removal, or they'll come to us because it's comforting. They're familiar with us. They come to an environment where they know it's not only about the dollar transaction. It's about us caring about them holistically.
Plus, what I want to add is that culturally, it's not easy for a lot of people to get a massage. It's like almost like a hump. You have to say, no, man, yes, and even the like a back massage for a gentleman, not a back massage, a back facial. It's as if we are almost teaching people on what services are out there and what you can actually do and how it can alleviate the issue you are having.
And it brings down the cortisol. It helps with stress, mental health.
Exactly.
Absolutely.
Because we have the sauna there, to the infrared sauna. And back to access and advocate and education. I like the idea of us being there like an oasis in our community to help people to learn about other areas of healthcare.
Yeah, when a patient comes into our practice to manage their diabetes, their high lipids, follow up for their cardiovascular disease or their diabetes, it's multifactorial. There are a lot of issues, as you said, cortisol rise with stress. Just living in a metropolis, driving to and from, interacting, just everything. The cost of just living here. They're coming to a setting where there are people who care, who recognize them, who they come to my front desk and we have staff members who will say, "Hi, Mr. Jones or Mrs. So-and-so." They haven't seen us in 2 years and they're recognized immediately. And when I see them, because of my relationship over the years and part of how I trained, because in the Caribbean Medical School, UWI, you're taught to be very social and to know a lot about your constituents. So when someone comes into my practice, I frequently immediately know all the background stuff. The kid that is away in wherever they're in college, the family issue that's happening, the other health issues of some other family member. And all of this is taken in context. A patient will come in and frequently the first thing will be, this was the wedding, like yesterday. Patient was showing me the wedding of his daughter.
Granddaughter.
Where was it? In Vermont. You're showing me pictures, we can relate. And then his parting words was, "Doc, how long have you been my doctor?" And they said, 30 something years. I was like, it's possible.
It's very interesting. What I find is that you're marrying both of these, the medical and the spa. So Dr. Tor, tell me a little bit about what people can expect when they walk in. I'll do a testimonial. I had a facial. You graced me with a facial just to get a feeling and I felt like $1 million afterwards. I was so relaxed.
We're happy to hear that.
So what's that like for you?
Well, to continue on the topics we discussed while you were in the office, I think a holistic approach to healthcare begins by starting with a rigid framework in your mind of items to cover and the patient's area of concern or the reason they've come to the office, whether as a primary care patient or to utilize spa services such as a facial or massage, or to receive some type of beautifying treatment like wrinkles with Botox or Dysport or facial rejuvenation with the Candela laser. We have...
So this is state-of-the-art facilities.
Yeah, we're pretty proud of the products that we're getting from Galderma. That's a Swiss company that produces Restylane for fillers that can help people who find that they have areas around the mouth that are changing or a face that appears to be deflated without the need for a facelift. And I say that I approach situations with patients, clinical situations, with a rigid framework in my mind. That would be things that I cover with all the patients, even if the vast majority of the visit is dedicated to something that's really bothering the patient or something that is really bothering me after the discussion. So the medical history, the surgical history, a review of systems, of course, the social history of the patient, their family history, and reminding women about the mammograms. We're in October, so I'll remind everyone watching that the pink awareness is a reminder for women to have that screening performed. Beyond that, the colorectal cancer screening and pap smears. For men, discussing the prostate health or any screening that may be indicated for them. And beyond that, a physical exam, which starts with visualization, perhaps a stethoscope or palpation, and then finally reviewing any imaging or lab results that have already been performed to minimize any expenditure of healthcare dollars for something that actually already exists, and always discussing with the patient my understanding of everything that we've gone over, a so-called assessment, coming up with some type of plan, even a rudimentary one. But I formalize that process because I find it's less likely to overlook something. It's less likely to neglect an opportunity to address something that could really impact someone's life in a positive way just because we're so focused on something that's really salient. So to summarize and to answer your question, with my view of the wellness center and the holistic element, my parents and you, Farah, touched upon cortisol, people's mental health. That's the last thing I've been really rolling out for the last couple of years, telling every patient that I meditate once a week, I journal on a daily basis, and Man's Search for Meaning by Viktor Frankl.
Wonderful book.
El hombre en busca de sentido. That's just one of the languages.
Oh, yes, he's bilingual.
It's been translated. So
Beautiful book.
I find that when people are centered, they tend to feel uplifted and grateful. And when they run out of things to write in their journal and they're like, wow, my life is so boring, it's because there are no bombs going off and no mosquitoes biting you with no air conditioning, your windows are open. This luxury to sit around and reflect is something that very few people are afforded. And that's just one of the tools to help the patient see how their behaviors are affecting them and ways to optimize their health in their quotidian life.
And what I found also beautiful in the atmosphere is you're right on a lake.
Oh, yes.
Tell me about that, Dr. Jarrett. It's like Serenity Lake there.
Well, when I was looking for a place to purchase, as we actually looked next to this building when we were first looking, and
Oh, we could have been neighbors.
Hey.
well, it was going to be crazy money, and so we said no, and then so we looked in West Kendall.
You call it? We
and I
headed
tell
west.
you, it's interesting. At first, when we found the spot and we got a pre-construction offer in, we looked at other spots. I had patients from Gables Estates and Coral Gables and so on who said, "Doc, we love you, but we'll never see you again because it's too far." That turned out not to be accurate. We found this lake, and I insisted on having the spot on the lake, and we designed the spot to try and maximize our view of that lake, and it's actually very pleasant. I might have made some mistakes in my architectural renderings, but it turned out okay.
It's beautiful. And Sandra, let's talk about the wellness evaluation and the personalized care, focusing on preventive care, preventive medicine.
Well, when the patient comes in, as I said, we really try to think about the person, and I probably can fast forward to with prevention. That's where you might even think about massages or things to help somebody to have a good daily plan, whether they're going to exercise or things of that nature. But also for prevention, that would be what Dr. Tor touched upon with the mammograms and being allowing people to know all the different measures that they need to take care of to be healthy. I mean, one of the things that I do in the practice, we have different guidelines, because I'm also the paperwork queen. And we have something called HEDIS, where, especially for older folks, we have to know about their mammogram, their eye exams, and different measures to help people to stay on task. But we always say we love the patient, the educated patient who wants to be in partnership. Answering your question again about prevention, and Dr. Tor does it, which I love, is telling people about the benefits of stretching and all these different
Hydration,
yes,
nutrition, adequate and appropriate nutrition.
yes,
So these are
yes, yes.
Everybody
yes,
take
yes.
a sip. Everybody come on,
Yes,
let's do it
yes.
together. Cheers.
Yeah.
Cheers.
Yeah.
chin chin.
I know one of the things Dr. Tor will do, he will offer people water. So we know we have to have the cups and the water there already.
Well, talk about
Yes,
hydration.
yes,
Well, talk about
yes.
hydration because that's
And sun protection.
Oh, here we go.
Oh,
I
my
have it as
goodness.
my cue.
Yes,
Sun protection.
yes. Dr. Tor has been really refreshing to bringing all these things. Let us think about self-care and help you to just be more complete in your outlook about yourself.
Well, last week was mental health week. Well, it's
Isn't
time
it every
for-
day, 365,
But
24/7?
there are just some obvious things that we should all be doing.
Tell me
you know?
about them.
Some of the things, for instance, the sense of community, socialization.
Oh, that's big.
That's critical. There are so many people who are alone in this big, crowded city. The socialization is critical.
If someone's listening right now, talk to me or talk to my audience, our audience. Where do they start? I'm not feeling good. I feel alone. Is it, do I need, I can't even phone a friend. Some people are,
Well,
talk about that.
The era of having socialization in a synagogue or a church is less and less. Or young people, for instance, coming out of high school and college, their ability to socialize in a safe, healthy way is so constrained by perception and the media telling them constantly.
Well, look on the social media. I'm on Facebook and I see everybody happy and I'm miserable.
Because people
And
only
sometimes-
portray on Facebook the happy times,
That's correct. So that leads to depression.
right?
That leads to isolation.
So certainly to refer to our Oasis practice again. When you come into our practice, and I'll say to patients, we've just, for instance, restarted for regular patients a walk-in day concept. We stopped it during COVID. On Monday mornings, if
Pre-existing.
there's an issue, pre-existing patients, you can walk in and I will see you. The first person through my door on Monday morning, I will see you. And I think that's important. You have that little anchor, you can come to me. You will have in our practice somebody who's going to listen to you, talk to you. I had a patient come in yesterday who saw an ophthalmologist who's recommending the expensive lens replacement. That's over and above our insurance company coverage.
It's $2,000 approximately
Well,
for each eye.
I'm not knocking any
She's almost
specialist,
90 years old.
but she came in to me, but rather than talking to the doctor who was recommending this, she said, "Doc, I felt so intimidated. I don't have that money."
And she said she couldn't sleep all night. Can you
So-
imagine that?
So she came to your office early in the morning and you saw her.
Of course, yeah.
And
So we put a call out to the ophthalmologist, and he's supposed
We're
to call
waiting.
me back.
Uh-huh.
But the whole point is,
but you were there as
I
her
was there.
friend, as her connection, as her spokesperson,
our advocate.
and her advocate. I was going
Advocate,
to
we
say.
definitely feel like we're part of the family. And more, what they call the sandwich generation, meaning the folks, maybe let's say our age group, they are working and they don't sometimes have the ability to spend the time with their elderly parent. And even my staff member, Martha, I mean, I feel as if she's a family member of so many of the patients because they rely on her for little questions, We are such a vital part of people's families
It's
now.
a real resource.
Oh,
it's not,
man.
It's not
The need
theoretical.
is so much.
It's just trying to interpret the rhythms of this healthcare conundrum.
Oh,
It's,
we're found ourselves in a time right now as administrator, and then you also have the health insurance companies that have had to learn how to read these graphs and these. I love reading graphs, though. Thank goodness for that. But they present all these reports with the patients.
It's hard to navigate. It's
yes,
hard to navigate.
But I always have to remember priority, patient advocate.
So, and you collect and you accept all insurances, or we can
Most
call,
of
you
them.
call the office to
Yeah,
find out.
definitely.
And Medicare
Yes,
Of course,
Medicare.
and the
Medicare
underserved
for
community.
Somewhat, if they're
Yes.
affiliated with Medicare in some way.
Absolutely.
So we try our best to be there as a resource for our community. It's interesting, I was just talking to someone yesterday about this young man who came to our practice when I was still seeing babies. His mother forced me to take him as a patient. And we took him and we guided him through the process of deciding on high school and magnet schools. He went to Mast. And then when he finally was getting ready to apply to college, we helped him with the process. He brought the application forms. And when he got his acceptances to college, he brought his fat envelopes. And I sat and went through them with him. So he went to Dartmouth. And we're still in touch. Even when he was at Dartmouth, he'd call me. And then when he applied to medical school, he brought his fat envelope versions. And he's now at Yale doing his MD, PhD. And I just called him yesterday when I was talking to someone, just to find out how he was doing. And he was saying, well, I love it up here in Connecticut. I was telling him, so we need you back down here, you know? We'll see. That's still an ongoing sales project.
But it's a legacy brand. You are a legacy brand, not only for your family, but for the community. You're helping young people, young minds. You inspired your son. Let's talk about that legacy as a brand, as Dr. Jarrett's Wellness Center.
Well, legacy, at no point in time did I expect that my sons would do what I did. But
They're watching. They say your kids are watching you.
We did more than that. When I was, for years, I did home visits on hospice. And on Saturdays, we'd do rotating. I'd put on a white coat.
Give him a little
lab coat. And you carry the bag, and I'd drive. They'd come with me.
My thing was go and see what your father is doing.
What was that like for you, Tor? Mm-hmm. Dr. Tor?
That's a good question.
Yeah, it was a positive experience because we would go to different neighborhoods, very different from the one I grew up in. And my dad would say, well, Tor, you see, I'm fearless when I come to these places because I know that I'm here for a good reason. And people who see me, I know that they'll have a good heart as well. And I was like, wow, he seems awfully confident. But that belief in the mission was touching. It was inspiring to be able to go into people's homes. And even though I didn't understand a lot of the medical basis for decisions because I was like in middle school or even elementary school, it was very clear to see on a human level what was going on and the fact that my dad wasn't talking while these people were talking. Even if they had difficulty expressing themselves, he was patient, and there was always some success in terms of coming to a common understanding during those visits. So before medical school, I worked for a home care agency, and I got to travel around Broward County and go to some places where older adults are during the day to explain what the home care agency had available. And beyond a sales position, this felt like another opportunity to almost be like the young men I see on their missions from Latter-day Saints or something, like going out into the community, dealing with people, being really patient, and understanding you have something that's limited to offer, but believing strongly that you're doing the right thing.
Beautiful. I think I could sit here for about hours and hours talking with you. We're going to have you all back again. But closing, we have a couple of seconds. Just each of you want to just talk about maybe something that I didn't cover in our time together that you would like our audience to know about.
Well, just quickly, we also do clinical research. We have clinical, typically sponsored research in medical phase 3 studies. I think that's important because this is also part of the continuum of exposing the community and giving people an access to clinical research in communities that are real or local and not just anybody else. So this is also part of our practice.
Sandra?
Well, I wanted to thank you for what you're doing because I really appreciate community involvement and actually knowing who is in our community, because sometimes people cannot guess and sometimes people are in their little groups. And that's one of the things that I love about our practice. And even when I hire folks, I always try and think about diversity, inclusivity, and where my office is close to the front desk, I'm always game on to kind of know how are the patients being treated. And the waiting room that has that open, no sliding glass, we designed that office so that people can not feel as if we don't know they're there. So it's very important for me that we have a sense of community in our practice. And for my staff, my game team, even during COVID, I was happy that they could always come to our office and feel safe, and also know that I am always there for my staff.
It's always been a pleasure being with each of you, and we've been in each other's orbit for quite a while now. And every single time I feel your humanity, your humility, and your wanting to make our lives in the community better. So I thank each and every one of you for the work and the contribution you do to your community. So thank you for being my
Thank you,
guest
Fara.
today. And if you want more information, it's going to be on the bottom of your screen. You can get them on the website at drwjarretts.com for more information. I want to thank you for joining and stopping in today. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a great day.